While the Bible frequently mentions disease, it is almost always with regard to its divine causation. Physicians and the study of medicine are virtually never mentioned. In this passage, Asa is criticized for seeking out physicians rather than God. 2 years after this affliction with his feet, he dies. Many theologians then echoed these ideas. They argued that disease was divinely caused and that it was better to seek the cure of disease in prayer than it was from physicians. Some argued that it was actually foolish or even potentially sinful to seek the cure of disease from physicians. Some argued that since God had sent the disease for perhaps some reason such as divine punishment or to test one's faith, that it was actually immoral then to seek to circumvent this divine will and cure the disease that God had sent. In this atmosphere, many physicians were criticized, persecuted, imprisoned, some were killed. There were common sayings such as, where there are three physicians, there are two atheists. When vaccination or inoculation, its precursor, were practiced, many theologians vehemently deposed this, and there were a number of anti-vaccination societies which were founded on the belief that only prayer should be used to treat medicine. Some physicians were thought to be in league with the devil because if demons cause disease, then physicians who cure disease must be in league with these demons. The father of anatomy was criticized when he did not prove that there was a resurrection bone which did not decay, from which the body could be reconstituted, or that men had one less rib than women. When chloroform was used to ease the pain of childbirth, it was criticized because childbirth was established in Genesis as a punishment for Eve's transgression. Even until modern times, there are religious sects which feel that blood transfusions are immoral, or that transplants were essentially cannibalism, or that x-rays were from the devil. Or in this statement by Mary Baker Eddy of Christian Science, the treatises on anatomy, physiology, and health, sustained by what is termed material law, are actually the promoters of disease and sickness.